At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Is Sugar Still Public Enemy #1 on Wednesday, May 21st at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to Dr. Tom Roselle Live. This is yours truly, and we got another interesting program, one that may save your bones. And yeah, we're going to talk about osteoporosis, but as it relates to the topic we've been kind of tweaking and leading up to our May the 21st program in-house at the Roselle Center for Healing in Fairfax. So what are we talking about? We're talking about sugar. And you didn't know that sugar had an effect on your bones, but we're going to get into that and really kind of dig through it just a little bit. I'm going to make you a little upset because if you are a sugar junkie, your bones are at risk, and I'm going to tell you why that's so, but I'm also going to tell you what you can do to make a difference with that. So remember, I want you to follow me on all my social media sites. We're probably on everybody's site. All you have to do to follow, go to drtomroselle.com, and you can link in that way, or you can simply go to your favorite site, whether it's Instagram or Facebook or X or whatever it is, and find me and follow me, and you'll get all the data that we send up on a very regular basis. So having said that, let's get into the program. Before I do that, last night I went to a political dinner, and I usually don't do those things. I kind of keep my head underwater as much as I possibly can. But it was the Lincoln Reagan dinner, and it was a very interesting night. The keynote was Lieutenant Governor Winsome Sears from Virginia, and obviously she's running for the governor position. And I did it for a couple reasons, but the most important one is that I'm very interested in any leadership position as it relates to freedom of healthcare choice. And I wanted to find out really by looking, I'm really good at body posturing and look at people's eyes and so forth, but also the words that they choose to use on how they present themselves and are they real deal human beings. And you know what? After I walked away from that, and she's a conservative woman, she's military background, she's had a tremendous amount of experience in a lot of different areas. So what did I think? I think that she's the real deal. I think that she's legitimate. I think that if you ask the right question, you're not going to get a sidebar, slide away type of answer. You're going to get a real straight up situation. Those are the people that get my attention, and but I'm going to keep watching. I'm going to see what it looks like, because at the end of the day, your health care is my responsibility to give you the truth. And I want to make sure that if somebody asks me the question, what do you think of this person? I'm going to go to the other side. I'm going to listen to them too. There's things that I don't like. Right now, there's a push to put through it's called an amendment in the Virginia Constitution that will allow abortion anytime on demand up until the time of birth. Now, I don't know about you, but that grabs me in places that, we won't describe here on the radio, but obviously I'm like 10,000%, maybe 1,000,000% against anything like that. And when you don't have the respect for life, you don't have the respect, you should not have the respect of people to lead them, no matter what the situation is. So for me, it's real simple. Healthcare is the primary issue. Healthcare is your right, and to choose, to decide what you want for yourself, for your family, make sure that your children are getting the support mechanisms that they need to have. And, it comes down to are you willing to take the action steps? But anyway, if, I'll let you know when I go do these things, and I'll give you the feedback. You can reach out to me at drtomroselle.com. You can ask my opinion. I'll give it to you offline. Might even put a little sidebars in there. But nevertheless, let's get into the program. I just wanted to let you know what I was up to. And what's coming down the pike, because this election in the state of Virginia is going to be the bellwether, if you will, for what's going to come up in midterm elections federally in the next couple of years. Having said that, let's talk about sugar and why sugar still is public enemy number one. There was an article that was published just recently, like yesterday and today, and it was talking about what the damage is that sugar is. And we talk about fat. Fat's been blamed for decades as the primary driver of obesity and heart disease and diabetes. And if you've listened to me on a regular basis, you know that's not really true. There are fats that you need to have on a day-to-day basis, but the trans fats are the damaging things. Trans fats are ones that will harden things and cause degeneration and cause all kinds of problems. Now, what are good fats? Well, good fats are the guys that you need, like olive oil and avocado and things of that nature. And when you get those in your body, they actually heal things. They help with the neurological system. They help with brain function. They help with hormonal development and so forth. But let's get into this a little bit. So sugar, is I've said for decades, is the real problem. Sugar is a poison, straight up. It causes neurological degeneration. Obviously, it's going to push you into diabetic. It's going to push you into blood sugar dysregulation. And there's a lot of information that's out there. It even potentiates and it causes progression of ALS, known as Lou Gehrig's disease. ALS is allometric lateral sclerosis. It's a degeneration of the nervous system, and pretty soon your body drops dead because it doesn't know how to receive the signaling mechanism anymore. Even autism, Bell's palsy, and carpal tunnel problems, and bone pain, and diabetes, and gallbladder disease, and heart disease, and migraines, and you name it, it goes on. I've been saying this for years, and now the information is coming out. So the solution is what? Is kind of, get rid of the sugar. We've talked about many times that right now in the good old US of A, we consume about 170 pounds of sugar per person per year. Did you hear me? 170 pounds. Now, I don't get even a small smidgen of that, a little bit once in a while, but it's usually honey and natural types of products. So if I'm not getting a lot of it, who's getting mine? All you got to do is walk outside, look at people walking around. You can say, oh, that's where the sugar's going. So, when you treat patients in our practice that come in with pain, neuropathic pain, and when we talk about neuropathy, there's peripheral neuropathy, there's distal neuropathy, there's central neuropathy. All it does, it signals where the nerve is degenerating. But the common denominator, as far as I'm concerned, behind all degenerative diseases, whether it's MS or ALS or the problems that all of a sudden you don't feel anything, and it could be other than neurodegenerative diseases, sugar. Sugar is the problem, or things that turn into sugar quickly. So what are the first signs of something that may be going wrong? And it's something that you may not even be aware of, particularly if it's MS or the beginning stages of Alzheimer's or things like that. Your sensory perception, it could be your smell. Why? Because the nuclei, the area that the nerves for smell come from, is in our brain, and that's where Alzheimer's starts, where the ALS pattern starts. Or sometimes it's other types of sensory perceptions. They would say, it's not a big deal, just something that's showing up. Now, we've talked about repetitively that cancer loves sugar, and we're going to extend that, and we'll have that conversation later on as well. But cancer, the reason that they do something called a PET scan, which is a CAT scan, And basically, they're injecting a radioisotope sugar into your bloodstream, and then they're taking pictures of it. Why? Because it goes to the cells, because the cancer cells love sugar. So it goes there. Now they can take a picture of it. Now they know how bad it's spread into soft tissue. Heart disease, same type of thing. The arteries get all plaqued up, not because of fat, my friends, not because of fat, but because of sugar, right? So when you take a statin to prevent heart disease, you're not doing anything because the cholesterol is not the problem. It is not the problem. If you really study the literature, cholesterol and heart disease, they're not even close in the ballpark. There's some studies out there that say like 0.6% of 1% is attributed to cholesterol. And we're dropping these fats down that your body needs for hormone function, for brain function, for healing, for tissue, for skin. And that's why we're looking old and crinkled and we don't have a mind anymore and our hormones don't work. Often it's because of that type of approach to stopping heart disease. You're being lied to on a very regular basis. Why? Simply because of the fact that it's a huge business. Cardiovascular disease is a huge business. Years ago, my wife and I still talk about the story, and I'm going to just segue a little bit. And this is when she was in graduate school working on her first master's degree. And she's the brain in the family. She's got a couple of them. And she was talking to this physician who was involved in cancer research, and she asked him a question. The question was, when do you think they're ever going to find, or will they find a cure for cancer? And he looked at her, smiled, and he said, never. And she says, what do you mean never? The billions and billions of dollars that are spent. She said, it's too big of a business. They can't afford to find a cure for cancer. And the same thing goes with heart disease across the board. Just think about the billions and billions of dollars that are spent every year on aspirin and statins and other types of drugs to control and regulate the deposition, of supposedly fat and prevention of heart disease and so forth. They're off target. It doesn't work that way. When I was in school, back at, as I say, when the dinosaurs ruled the earth, at my old alma mater, Kent State University, they did a study, and we're talking years ago, we're talking 50 plus years ago. And they had people who had suffered massive strokes and heart attacks, but they were starting to become functional. And what they did is they measured, as best they could back in the day, their level of coronary plaquing, of arterial plaquing. And all they did with these guys is that they started to walk them. In some cases, they couldn't walk more than maybe even 50 feet without having to stop. And then maybe 75 feet, and then 100 feet. And pretty soon, over an extended period of time, they were able to get them to start walking a quarter of a mile and start walking a little further and resting and walking. But they did it every day. And the study went on. You know what the interesting fact was? That every one of these guys, probably not every one of them, but I think the statistic, if I go back in my memory banks, is like 90-some% of them not only recovered functionally, but they measured the collateral circulation that was developed as a result of exercise. Now, what does that mean? Well, collateral circulation means that there are extra capillaries, meaning arteries and blood supply that is going to the tissue that helps revascularize, put new blood in, new oxygenation in, and they were able to, in many cases, be able to function at a much higher level. So that's part of the story, and that goes back a lot of years ago. So if that's the case, if we know that exercise makes a difference and it burns things up, the sugars that you actually do get, so what's the deal here? So let's go on with our conversation because I really want to touch on the sugar thing. And by the way, don't forget, circle the calendar, May the 21st at the Roselle Center for Healing in Fairfax, 6 p.m. Dr. Scott Lamp and I are going to talk about why sugar is still public enemy number one and how it relates to all these things we're talking about, from tremendous amount of pain and anywhere in your body, the potentiation of cancers, degeneration conditions, and so forth. All you have to do to join us is go to Roselle care.com or drtomroselle.com and register. If you'd like to do it the old-fashioned way, real simple, 703-698-7117 and register. The only thing we ask you, as always, is that if you can't make it, call us, please, so we can make sure that there's space for somebody else that really wants the data, wants the information. But I promise you, you're going to walk away with, oh my God, I didn't know that, but more importantly, what you can do about it. So what's the worst of the worst? High fructose corn syrup is the number one culprit. If we had to have, the top 5 sugar culprits, high fructose corn syrup is it. It impairs liver function. So guess where cholesterol comes from? It's called the liver. And so if you're eating all this sugar, refined crap, this garbage and so forth, you got a problem. It suppresses different hormonal platforms, from leptin to hormones that regulate appetite and so forth. Then you get hungrier and you start, increasing that I want more of the sugar, where you should be eating a lot of protein and vegetables and things like that. That's why people who consume high fructose corn syrup in the forms of what? Those sodas that you like all the time, and other processed products, and so forth, and you can't stop eating them. They're addicted to them. That's why, because the leptin level goes down and your hormones get deregulated and you start going mad because you got to have, all of this nonsense, if you will. Anyway, so it goes on. And so you have to bite the bullet. You got to start cutting down on, your bleed, if you will. So think about the grapefruit that you eat in the morning. You put sugar on it. Your mama told you to do it, right? Because she was trying to get you to eat something that was good for you. And, today you don't do that. Why? Because the grapefruit is a whole lot sweeter than it was years ago. And so if that's the case, and you add a little sugar to it, you got a problem, my friends. How many of you just sit there and say, well, I just eat fruit? Yeah, by the bushel basket full. And that's sugar as well. So you have to be really careful, that what surrounds you is what's getting you. Now, so, the checklist is like cancers and fat and, dementia and the Alzheimer's and colds and flus and allergies and chronic pain patterns and menopause and, even autistic syndrome patterns, high blood pressure and heart disease and so forth and so on. What do all these, and the list goes on, by the way, I haven't even begun to touch on it. What do they all have in common? It's the consumption of sugar. Now, I promise you we touched a little bit on osteoporosis. Now, osteoporosis and sugar consumption are connected because it means bone loss, right? You got a lot of bone loss. You're going to break something. You're going to fall down. It may kill you too. Osteoporosis, if you have bone loss, you have to avoid sugar and excess amounts of salt and trans fats in your diet. High sugar, high saturated trans fats have been linked to a dramatic increase in osteoporosis and bone fractures, particularly in women. So ladies, that sweet tooth that you got? Remember your bones, remember your hormones, because it has a tremendous effect. Remember we just said about, it affects liver function? Guess where your hormones are processed and regulated? It's there. Consuming all these sugars in your body depletes, takes away nutrients like calcium and potassium and magnesium. The high fat or high sugar, can impact your structural integrity. When I'm talking about fat, I'm talking about trans fats, all the fried chips and things that you eat, that kind of stuff. Yeah, those are the ones I'm talking about. You have to avoid a lot of different things. And if you want to control that bone density, but one of the primary things is sugar, other than having an apple periodically, or a little bowl of cherries, or a little bowl of blueberries, or something of that nature. Don't stuff, well, I'm going to have a banana this morning, I'm going to have a bowl of fruit this afternoon. Tonight before I go to bed, I'm going to have something else. That's a lot of sugar, my friends. You're not supposed to be doing that. You're supposed to be increasing your protein, high levels of vegetables, and making sure you're getting good fats like olive oil and avocado and things of that nature on a regular basis, on a day-to-day basis. Please understand that, you have to make sure you have to make sure that you're getting the right amounts and right balances of all kinds of things. But if you're a sugar junkie, I promise you, you're risking a lot of things that are going to take you out from this world. Not okay, not in your best interest, so to speak. I sit there and I go and I teach at, different athletic organizations on Division I levels. And I talk to these big monsters, if they're football players, or these strong, tremendous athletes, if they're gymnasts and track stars and so forth. And I tell them, look, I said, I think most of you know that the fuel that you put in your body is going to be straight up relative to your performance. And it's, sugar will cause a short burst in energy for a lot of these athletes. But if they continue to do it, it goes the other way. It goes down the slope. It does the same thing for us. If you have lunch and you haven't eaten, probably for several hours, and you say, I got to get something to eat, your brain goes dead. You go into that, cranky, hangry state. And then you eat something and you want to go to sleep within about 15, 20 minutes. I'm telling you, your blood sugars are way off and you haven't been protecting yourself the way you should. There's no balance that's in the system. So we have to make sure that we're very aware, that we're protective. And if we're not, if we don't continue the ongoing education, we could have a problem. We're coming up rapidly to the break in the program. I want you to remember that I'm here every Sunday, simply one reason only. I love you all. And join me right now. Go to drtomroselle.com and let's get it together. And, I want to leave you with a couple thoughts as we go through the process here. What if your body was, in fact, able to resolve and correct and change virtually everything and anything that happens to it? What happens if that was really true? Would you honor it? Would you increase the process of being able to turn things around? Or would you continue to degrade, thinking, well, I'm going to die anyway? I don't know about you, but I think maybe that living life at the highest level possible, giving yourself your best ageless health. That's my book, by the way. Remember that? Ageless Health. Health is a do-it-yourself program. Put it in your hands. I'll see you next week. Follow me now. Remember, I'm here because I love you all. Have a great day.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Is Sugar Still Public Enemy #1 on Wednesday, May 21st at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com. Neuromuscular dentistry is more than just teeth and gums. Neuromuscular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live. If you're in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Visit softtouchdentalcare.com or call 703-319-6990.
Thank you.